Hi, I'm Dr. Christi Crumpecker with Kansas City Direct Primary Care, and welcome to Navigating COVID-19 as a Small Business. It's December 2nd, 2020 still, and it's important to note the date because the only thing that's changed faster than the weather in Kansas City is the COVID-19 guidance. So I'm going to strive to provide the most up-to-date guidance that we have for our fellow small businesses as we all figure out how to navigate the twists and turns that have been coming with the pandemic. I have about 20 minutes worth of material to share. And afterwards, I'm happy to take any questions that you have via the live chat, and we'll do my best to answer them. And we'll also have this material saved both in a printed format and in video format if you'd like to reference it later or know anyone else it may be of value to. I want to make sure that everyone's aware any information I provide is not intended to replace or override OSHA guidelines or any guidelines from the CDC, and is not intended to replace or override any city, county, or state mandates or restrictions, which vary quite a bit in the Kansas City area. Some of them are even different in the 5 miles between where I live and where I work. So those are things that we all have to be aware of based on our individual location. And there are certain industries that will have specific issues that they must contend with specific to the type of business they practice, like gyms and salons and restaurants. Or there may be facility specific concerns. And any specific questions about those types of businesses, I'm happy to answer to the best of my ability in the question and answer section. But again, OSHA guidelines and CDC guidance still apply. I'm going to do my best to just stay in my lane and approach this as from a medical provider, a primary care provider in Kansas City's focus on pandemic safety, but also with attention to the fact that we understand that our fellow small businesses are trying to find ways to stay open safely and be attentive to the health and safety of their customers as well as their employees. And that there's a lot of complicated decision making that goes into being able to keep up with COVID guidelines, provide a safe environment for customers and employees, and continue to operate a business. So I do recognize that there are a lot of challenges there, and I will strive to stick to the medicine. Everything that I am going to reference or provide as evidence-based information that came clear up till this morning when the CDC announced changes that have not been posted on the CDC website yet, but I will make you aware of that those should be coming soon. And as well, I have a few personal anecdotes that I will reference because I recently moved from Missouri to Kansas, and so have had to run a few more essential errands than I typically would, and have been a bit of a secret shopper in a few places in the area. I won't name any place, but just noted some really great strategies different businesses have been using to promote pandemic safety and maintain their business practice. So first things first, the most basic elements of safety during the pandemic for customers as well as employees and business owners is exactly the same things that we've been hearing about since the very beginning of the pandemic. Wearing a mask is important. There are, of course, cloth masks is what we see most people using in the just day-to-day world outside of the healthcare medical setting. They do provide some amount of protection to prevent spread from somebody who may be sick with COVID and asymptomatic, and also some protection for the wearer. The mask should fit well. I know that some businesses are providing masks for their employees of a particular style. And it's important that it fits well on the face, both because gaps around the mask leave open space that doesn't provide protection. And also, if the mask doesn't fit well, it encourages people to touch their face frequently, which is something that we're trying to avoid as they continuously adjust their mask. One other thing I will mention, because I struggle with this personally at work, is the mask with glasses issue of having your glasses fog up. And I have seen several creative strategies that people have used to try to prevent issues with glasses fogging up. One of the best ones that I've found is using a cloth mask that has a bit of wire in the bridge of the nose that can be molded to make the mask fit better to my face and keep my glasses from fogging up while I'm out and about. And then, of course, there are disposable surgical masks, and then the N95 mask that you hear mentioned. And just for example, like everybody I'm sure has seen and been wearing cloth masks. They work best if they're one layer of fabric, and some of them you're able to slide a filter into as well. A basic disposable surgical mask. And then the N95 mask that you hear talked about a lot. This is then an example of one that could be purchased at least prior to the pandemic at a hardware store. The ones that are intended for use by medical providers actually are fit tested to the face and have a rubber seal around them. And those are not the ones that we're typically talking about in these non-healthcare settings. For customers and employees of most places, cloth mask or disposable surgical mask is actually a bit better if that's something that you are able to obtain and provide. Social distancing, the same typical 6-foot rule, and trying to avoid more than 15 cumulative minutes within 24 hours. Within 6 feet of space of someone. Hand hygiene, hand washing for 20 seconds with soap and water is the best strategy. If that is not possible, hand sanitizer is certainly an acceptable substitute and better than not cleaning hands at all. And if employees or customers are sick or exposed to COVID-19, they should stay home. So these things are easy to say, but they're harder to do. And I think that most of us recognize, even as individuals, if not more so as people who are trying to operate businesses, that the best laid plans and the very best practices can be difficult to apply and still actually run a business or do any kind of even essential errands as a customer. So I've kind of compiled some information to hopefully emphasize some of the techniques and strategies that are supported by the CDC and OSHA that can, and the U.S. Chamber of Commerce, in terms of helping businesses stay open with safe operations for employees and customers, while acknowledging the fact that it is difficult for all of us as human beings to achieve perfection. And so, like we say in many areas of life, we don't want the perfect to get in the way of the good. And so we know that none of us are going to be able to adhere perfectly to anything, but that's not a reason to throw our hands up and say that there's nothing that we can do to try to prevent the spread of COVID. So one of the first and most important things that small businesses can do is to make sure that they're communicating clearly with employees and customers about what the expectations are. And that is both in terms of the responsibilities of the employees and the customer towards keeping the business safe, and what the business is doing as a company to keep the employees and customers safe. So throughout the pandemic, it will be important for business owners to update employees frequently and clearly when there are any guidance or business practice changes. It can be difficult for people to get used to one set of practices and then be expected to change them. So communicating that clearly to employees. Also communicating expectations to customers. And this is one of the things that I have found it's been very refreshing in some of the essential errands I've had to run recently with moving from one state to another, to see what some businesses have adopted to ensure customer and employee safety. Oftentimes you'll see signs on doors regarding mask wearing and social distancing guidelines, which is very important. However, I do think that with the onset of pandemic fatigue and the fact that those signs are on so many places, that some of the more creative door signs and instructions I've seen have seemed to capture the attention, perhaps influence the behavior of customers, and have oftentimes given people a bit of a laugh, which I think is a good, healthy thing during this time as well. I'll give you an example of one of them. Here is an example of proper mask wearing guidelines while in the facility. That has actually quite accurate in terms of both the wrong ways. We often see people wearing masks, and the correct way to wear it over your nose and mouth. Another one that I saw on a sign of a business, or excuse me, on the door of a business that often has handshakes or hugs between employees and customers. They have a sign that says masks up and elbow bumps, because they have shifted to using a safer technique to communicate a greeting or an end of a meeting with a customer there. So I think that signage like that can certainly be helpful. Also, visual cues for customers. Most of us, I think, have seen these in larger retailers, but if you can mark spots on the floor for helping people space out for social distancing. If you have meetings, if you have chairs around a table in a meeting room, not only spacing out the chairs appropriately, but taking out any chairs that would cause people to sit too close together, just to help ease the mental strain of trying to figure out if it's okay to sit in a certain place. And then the other things that, in terms of communicating expectations, is to employees and to customers as well, maybe in a door sign, is when to call out sick, or when to avoid coming in person. And then the last, and we'll go into that in a little more detail later. And then also, you want to communicate to employees the process for a known COVID-19 exposure, so that if they know that they've been exposed, who do they contact, and what do they need to let them know at the business? And again, I'll go into that in a little bit more detail as well. In addition to communicating those basic expectations, one of the most helpful things that business owners can do is make the difficult changes of this pandemic as easy to do as possible. So one of the ways that you could do that for employees is if you have a number of people that work in the same area, is staggering breaks or lunch schedules, especially if there's a small break room or area where people often take their guard down and take their masks off at the same time. And that's one of the things that could encourage spread of COVID-19 amongst employees. If it's possible to stagger work shifts, I know a number of places are doing that. And of course, there's certainly the work from home piece of this, if that's a possibility. Cross-training employees so that employees are able to cover for one another if somebody has an exposure or becomes ill and needs to stay home. And then one of the areas that I think presents a big challenge for small businesses is reimagining sick leave policy or ways and times an employee may call out sick. And again, I'm going to stick to the medical side of this. I know that this is something that every employer has to navigate for themselves in terms of what makes sense for their business and being able to continue to keep operations going. But the least punitive and most flexible system possible for sick leave right now is going to be the best strategy for preventing COVID-19 spread. And yes, there will likely be some people who take advantage of that at some businesses, but having employees who come to work when they know that they've been exposed because they fear having some kind of negative action taken against them, or having a written warning given to them, or in some cases, I know with some small to medium-sized businesses, they've actually temporarily included things like sick leave or paid sick leave, I guess where it's a partial payment for a certain number of days of sick leave, to make sure that employees are not incentivized to come to work or when they're sick, or to come to work when they know they've been exposed because they fear not being able to make ends meet. And again, that's something that, that's going to be different for different businesses, but it's just something to consider is the flexibility and possibilities with even a temporary adjustment to how you handle sick days. Another thing that can be very helpful for employees and for customers is having hand sanitizer every place you can think of to put it. Inside the front door for customers is a great location, because you know that the door in most places is going to be a high touch area. And although we are most concerned about respiratory spread, there certainly is concern about spread from touching your hands to surfaces that other people have touched and then touching your face. Hand sanitizer and sanitizing wipes at employee workstations, which they should, if possible, not share, and fully wipe down before and after shifts. And then you want to frequently clean any high touch surfaces. I have been to a few businesses recently where there's still a cup of communal pens on the desk for customers to use. I have brought my own pen, but that's something that in general I would discourage businesses from maintaining, or at least considering that that's something that needs to be cleaned frequently, and removing as many attractive but unnecessary high-touch surfaces as possible. And this includes things like display items, communal coffee pots. If I hate to say that one because I'm the one of the biggest coffee junkies I know, but if there are alternatives, it's going to be better to not have everyone handling the same material, or have customers that come in handling the same communal material. If it's not an option, to remove it from a lobby or waiting area or employee break area, making sure that the surface is cleaned frequently and that people are cleaning their hands before and after using it. And then considering creative alternatives for customer access to your business. This is something that I've seen a number of places in Kansas City do a really fantastic job of considering and utilizing all different strategies of reaching customers that help prevent the spread of COVID. One is, of course, reduce capacity in the establishment at one time, which we certainly have seen. There have been some changing guidelines based on city recommendations and restrictions, and those particularly have applied to restaurants and also some retail places. And of course, I'm not advising anyone to work outside of the local recommendations on those, but some places may find that for their individual business, and perhaps even the way it's arranged, say a small retail location, that choosing to reduce capacity of foot traffic further in terms of the number of people that are inside the establishment at one time may actually be beneficial to allow people to move about in this retail space comfortably without being within 6 feet of each other for prolonged periods of time. Another option is having a flow path through the space. Like if it's a retail space, I know a lot of places have tried one-way lanes or one-way aisles. That seems like it's worked for some larger places. It may not work as well for in a small setting, but something to consider. Appointment-based, even shopping, curbside or delivery service or online service. Of course, we've seen people use all of those options to great benefit in helping prevent the spread of COVID. Another thing to consider, and this falls under the making difficult changes easier to do, is considering as a business owner or manager the roles, responsibilities, and any protection modifications that may be needed for higher risk employees. And I would encourage business owners who are thinking about this with employees to consider issues that are listed on the CDC website and are updated frequently regarding who is considered to be higher risk. And also, and this is of course if employees have elected to disclose this information, if they are in a living situation where perhaps they live with a grandparent that they help care for, or something else that puts an individual in a higher risk category that they have close contact with on a regular basis outside of work. And then the last point about higher risk employees is we've heard a lot of talk about the concept of pre-existing conditions that could predispose someone to a more severe course of COVID-19 disease. And one point from a doctor's perspective, I just want to put out there is that many people who have pre-existing conditions are not aware that they have them. If a person, for example, has type 2 diabetes and high blood pressure and heart disease that have been diagnosed by a physician, we may be aware that they have pre-existing conditions. They may be aware they have pre-existing conditions. If a person has not been to a doctor in the last 10 years, they may also have hypertension, heart disease, and high blood pressure, but just not be aware of those pre-existing conditions. So as a physician, I encourage everyone personally, and also as business owners who are thinking about employee health and well-being and customer health and well-being, that we would probably be better to err on the side of assuming that more people are higher risk than assuming that people are lower risk in the absence of known pre-existing conditions, or because they are younger, things of that nature, that I think that we have focused on with such a tight gaze that we risk putting folks who are in fact at higher risk of severe disease in danger. I hope that made sense. I think that it didn't come out quite the way I meant it to, but I don't want us to be cavalier with the health and safety of people because we're presuming that their risk is lower when in fact it is not. And because we do see severe disease even in people with no pre-existing conditions as well. So focusing on everyone's health and safety, certainly, but I know that in terms of roles and customer contact, businesses do have to make decisions about who fills which role and which responsibility and what sorts of protection to provide to employees, and that might be some considerations that you have to make. The last thing that I just want to mention, and then I'm going to bring up a couple dilemmas that I've either witnessed firsthand or heard about from other people in small business practice. And they're kind of like they're questions that I'll go ahead and put out there and answer, and then I'll be happy to take any questions that any of you have for me. The last thing I just want to say is to be ready to adapt and adapt and adapt. As I'm sure that most of you are aware, we're experiencing surging COVID cases in many places, including in the Kansas City area. And the CDC has announced plans to change a guideline regarding quarantine as recently as this morning. However, I do want to point out they have not changed the guideline on their website. They have announced plans to change it. So this is something to be on the lookout for, but it has not actually been officially changed. They are planning to decrease the length of quarantine for a known COVID-19 exposure under their definition of close contact, which I won't go through all of the steps here. They have it on their website of how they define close contact, and that it is not dependent on whether or not a cloth mask is worn. But they've decreased the quarantine, or decreasing the quarantine guidelines from 14 days to 10 days. Or the other thing they announced is 7 days with a negative test. Now I have questions about this because I'm not sure when the person is supposed to be tested relative to their exposure. So for right now, the guideline has not officially been changed from the 14-day quarantine, but that's something to be on the lookout for, that they have announced that plans to change that guideline in the near future. So there's going to be some ongoing adaptation like that. Feedback from employees, of course, about what is working and what isn't working, and what ideas they have to solve some of the issues. We can have the best laid plans for how to safely interact with customers and then find that they just don't practically work in that particular setting. And feedback from customers as well, because part of the economic recovery and continuing to operate businesses does depend on keeping employees and customers safe. It also depends on them feeling safe. And then one of the last things I wanted to mention about adaptation is that, as I mentioned earlier, I've been a bit of a secret shopper as I've run some more than normal essential errands recently. And a couple places I've witnessed really very good ideas for maintaining employee and customer safety, where the customers have been kind of pushed back against them and the employees have had difficulty maintaining the boundaries of being able to have people socially distanced, have them wearing masks, those sorts of expectations. And I think that it's worthwhile to find out if employees are having difficulty. I don't want to use the word enforce, but difficulty with customer compliance or adherence to safety measures within the business, both because they jeopardize the safety of other customers, but also the employees and anyone the employees come in contact with outside of work. So that's something that I would recommend just keeping an eye on. And then the last thing that I'm just going to mention is a few dilemmas that I've heard come up. One of them is over the idea of daily wellness screens for employees. The list of potential symptoms for COVID-19 is continuously expanding. Temperature checks have been kind of a popular idea to have some criteria that is more data driven, but it doesn't seem to be as helpful in distinguishing who should be allowed to work for safety reasons. And then the question of many people have raised about travel in and out of the area. This is a big conundrum I found, because we are living and working in a high risk area right now. And I started looking through the different state and even county expectations for quarantine if people travel to different places. And it is different for pretty much every single state and area I looked at. So I am not really sure, beyond trying to be in keeping with local and state regulations, the best way to handle that as an individual employer. More than anything else, employee behaviors and contacts outside of the workplace are going to influence what they bring into the workplace in terms of potential asymptomatic COVID. So, of course, that's employees' personal time. There's isn't a way to, or a reasonable expectation to limit people's activities outside of work, but setting recommendations and and expectations the best that you're able to can certainly help. And then there are two other issues I'll just mention really briefly. One of them is the quarantining after the COVID exposure. And actually, I already mentioned that the new CDC guidelines look like they're perhaps going to shorten that time to 10 days or 7 days with a negative test result. Again, hasn't officially been changed yet, but keep an eye out for that. And then I've heard a number of questions about employees returning to work after being diagnosed with a positive COVID-19 test. The most current guidelines on that are that it needs to be at least 10 days after symptoms began, at least 24 hours fever-free without Tylenol or any fever-reducing medications. The employees do not need to have a proof of having a negative COVID test. And in fact, they may still have enough viral fragments to cause them to have a positive test result, even though they are not contagious with COVID-19 at that point. So the current guidelines are not to use that as a way to have people return to work. They may still have some symptoms, but they should be improving. And I think it's just worth noting that it's been noted in the medical setting that people post-COVID illness and during recovery are often experiencing some kind of symptoms and significant fatigue for at least 2 to 3 weeks after a mild case and up to 4 to 6 weeks after a moderate case. So it just, I think, is worth considering that employees may be able to come back to work, but still may not be their best selves at that point. Those are the major recommendations and pieces of information I wanted to throw out there, and I'm happy to answer any questions that you all have that you want to ask through the live chat. I'm going to grab a tissue really quick and pop right back on the screen. And just for the sake of good habits, my hand sanitizer. So let's see. I see there is a question about touching base on the current upcoming guidelines around employees who travel. And I hope I addressed that. It's not very, I'll be honest with you, it's not very clear to me on exactly the best way to handle this. I was just looking at some of the information recently for different states because I had a family member planning to travel out of town for to see a ill relative. And they actually found that there is a quarantine for Kansas that's based on travel to North or South Dakota on certain dates in October, or if you've been on any kind of cruise, including a river cruise, since March 15th, which didn't sound like it made a lot of sense to me, but that was the guideline for Kansas. So I started looking at some of the other ones, and they are kind of a piecemeal state by state issue. And then there are definitely some, metro guidelines as well. But I think that in absence of those, I don't have a particular guideline in mind as far as travel is concerned. Best practices for potential exposures on a case-by-case basis. So when we say potential exposure, I'm going to make some assumptions here, and if it's incorrect, please feel free to add in on the live chat some comments that might help help me orient my answer in the right direction. So if we mean potential exposure, like the person may have been around someone who was COVID-19 positive, or the may have been within 6 feet of them for more than a cumulative 15 minutes within 24 hours, with or without a mask, a cloth mask. Um, I think that some of those you will have to handle on a case by case basis, and they may be also dependent on what sort of work environment you have employees in as well, whether it's a customer facing position, whether their work position puts them in close contact with other employees, whether they're in a work situation where they aren't able to always wear masks, which I know that there are some of those as well. And so, yeah, I do think that there'll be a certain amount of case by case decision making as well for that. Okay. Right. Yeah. So I like that idea that traveling to work from home for a period of time to serve as or excuse me, works from home for a period of time to serve as quarantine. Yeah, I think for places that are able to do remote work, or to have some of their employees working remotely and using that as a quarantine period is a great idea. It also just eliminates some of the interactions, in-person interactions that occur in a workplace, in just when people are collected together in a building naturally. Yeah. Let's wait and see if anyone else has any other questions. I'll give you a couple minutes, and thank you all for who watched this morning, and thank you to anybody who takes a look at this a little bit later. I hope that the information was helpful. As Kansas City Direct Primary Care, we're one of your neighbor small businesses. We want to see all small businesses survive and thrive during the pandemic and after the pandemic. And we know everyone's very focused on making sure they keep their customers and employees safe. We applaud all of the hard work that you're doing with that. And we are happy to provide any medical guidance we can to help you in those endeavors. Yes, this will be available after, as soon as we finish, we will have the video available. I'm also going to post the information in a printed format so that you'll be able to have access to that as well. All right. I will assume that for those of you that are watching live, that there aren't any more questions at this point. We are happy to answer any other questions that we can if you reach out to us, and we will hopefully be posting more information in the future that may be useful to particularly small businesses in the Kansas City area. Everybody out there, stay safe and take care of yourselves and each other as we all work together to get through this challenging time, and we will all come out stronger on the other side. Thanks.